AirLife, a leader in respiratory therapy consumables, is pleased to announce an enhancement to the design of their oxygen tubing portfolio. This design enhancement affects the oxygen end connectors on all WestMed, Salter Labs, and AirLife branded nasal cannulas, end-tidal CO2 cannulas, and standalone oxygen tubing. AirLife tubing connectors connect to gas outlets that comply with the international tubing standards. This includes but is not limited to the oxygen fitting on standalone and portable oxygen concentrators, oxygen tanks, oxygen flow meters, and blenders. The ribbed end connector is compatible with a 5 to 7 mm tapered oxygen fitting, for example a Christmas tree adapter. The style of the tapered fitting will vary depending on the oxygen gas source or oxygen device. To attach the tubing, place the ribbed end connector between your thumb and forefinger. Align the ribbed connector to the tapered fitting, then push the end connector over the tapered fitting firmly until snug, about the second thread or rib of the adapter. Next, give the connector a slight twist to lock in place. Gently tug on the tubing to ensure a secure fit. To remove, twist off the connector in the opposite direction. Never yank or forcefully pull on the tubing to remove the ribbed connector from the oxygen source. The newly designed universal female threaded connector is designed to be used with a male DISS 1240 oxygen fitting or a 5 to 7 mm tapered oxygen fitting. Place the threaded connector between your thumb and forefinger below the threaded section. To attach directly to the flow meter's threaded fitting, hold the connector at a slight angle and push onto the threaded gas fitting. You can slightly wiggle the connector back and forth. Once attached, turn clockwise a quarter turn until a secure fit is achieved. Gently tug on tubing to ensure a secure fit. To remove, twist off the connector in a clockwise direction. Never yank or forcefully pull on the tubing to remove. To attach the universal connector to a tapered fitting, firmly push the end connector onto the gas fitting and turn clockwise until snug. Gently tug on the tubing to ensure secure fit. To remove, twist off the connector in the opposite direction. Never yank or forcefully pull on the tubing to remove. Our approach with these design enhancements was to bring the best features and benefits of WestMed, AirLife, and Salter Labs' combined expertise in oxygen delivery and EtCO2 monitoring, maximizing the customer experience and enhancing overall patient outcomes. All changes have been rigorously tested against all performance specifications. We are confident that the changes have met or exceeded all regulatory and quality standards as well as the high expectations clinicians and patients have come to expect of our brands. For additional information or assistance, please reach out to our dedicated AirLife representatives.